So this is it. This is what we have been prepping for. In case you haven't been paying attention, the World Health Organization finally declared this a global pandemic, and the United States declared this a national emergency. Even by conservative estimates, they're saying globally they're expecting millions of people to be infected, tens of thousands of people to die, possibly even hundreds of thousands of people, depending on the actions that we take right now. So here's what you can expect in the upcoming months. Virtually all countries around the world are going to go into a lockdown. They're going to require all citizens to stay home with the exception of going to the grocery store or to the hospital. We're already seeing this in countries like Italy and China, and it actually is proving effective at slowing the rate of infection. Many countries are going to bring in their military to enforce this lockdown, and we most likely are going to see a shortage of some foods, but not all of them, as supply chains get disrupted. Those citizens who are not prepared for this are going to be needing to rely on the government and the military to provide them food, like we're seeing in Wuhan, China right now. And there's a very real possibility that in many nations, and possibly even some cities in the United States, that we're going to see martial law enacted. Our hospitals are going to be overrun with sick patients with this virus, and this means that the other patients that are there for other reasons, such as car accidents, diabetes, cancer, they're not going to get the same attention and resources that they otherwise would. And so we're going to see an increase in mortality rate across the board. Even though these deaths will not be counted when factoring the mortality rate of this virus, they're still directly a cause of this virus. Our hospitals are underprepared for this, just like almost every other nation's hospital around the world. We do not have the number of ventilation machines that we need to treat all the patients who are going to need it, and we are going to see our doctors practicing triage as they determine which patients get the ventilation machines and which ones do not. We're seeing this exact scenario play out in countries like Italy right now, and they got their first patient about 15 days before America did. The global economy is not just entering a bear market, it's not just entering a recession. There is a very real possibility that we're just now entering a depression, like the United States saw in the 1930s. In most countries experiencing this right now, they've already shut down their schools, their businesses, and their non-essential government to help slow the rate of the virus spreading. An economy cannot function without consumers spending money, but unfortunately, it is the only way to stop this thing from spreading. Our economy and our society has never been tested like this before. How long can businesses go with 0 customers? How long until they start firing their employees? How long until people and businesses start filing for bankruptcy? My guess is only a few weeks, possibly a couple of months. And this is going to cause a spiral effect with higher unemployment and higher bankruptcies. And to add to this, many Americans are going to have their life savings completely wiped out with the stock market crash going on right now. Our economy is going to feel the effect of this virus for years. This is going to be the type of event that we tell our children and our children's children that we live through. So what can we do right now? Well, containing this virus is no longer an option. That window of time has passed. There's really only 2 ways to stop this virus, and they're both pretty simple, but neither of them are very easy. The first thing we all need to do is to shelter in place and not interact with anybody else for a minimum of 2 weeks, possibly longer. And this may seem extreme, but this is one of the only things that the countries who are already going through this pandemic have found effective. And 2 weeks is the minimum because as of right now, it seems like the virus has up to a 14-day incubation period before you start showing any symptoms. And if you did get to day 14 and then you started showing symptoms, yeah, you're gonna have to isolate yourself for even longer. At the start of this, our government told us that all we need to do is wash our hands, stay 6 feet away from people, and sneeze into your elbow. That is not enough anymore. We now know that if somebody were to sneeze or cough in a public place, those droplets would hover in the air for up to 3 hours. If you were then to walk into those droplets and inhale them, you could get the virus that way as well. Isolating ourselves from other people is unfortunately the most effective way at not getting this virus. There's really 2 best case scenarios that we're shooting for right now. The first is that enough people get the virus and build up an immunity to it that as a culture we build herd immunity to it. So essentially we have enough people in our community that cannot get the virus anymore, that it slows the spread, and those among us who are most vulnerable are far less likely to get it at that point. Now that does not mean that we want everybody to go out and get the virus so that we can reach that herd immunity level as quickly as possible, because by doing that, we're going to overwhelm our medical system, which is going to lead to more deaths. Instead, what we want to do is flatten the curve. Instead of seeing a big spike in cases, we want to spread out those cases on as long of a timeline as we can. So reaching herd immunity is one option that we are moving in that direction and trying to pursue, but honestly, that is not all that great of an option, and we're gonna have to sacrifice a lot in order to achieve herd immunity. The other option, which our country is also moving forward with, is doing everything that we can to just slow down the spread of this virus until we can discover and mass produce a vaccine for it. The best estimates put this at 12 to 18 months from now to have a mass produced vaccine. So again, this option is not that great either. Both of these options are going to dramatically disrupt our society and our way of life and have devastating consequences on our economy. If you want to see my video on what items I think you should and should not be buying right now, click right here to check that out. And I wish you guys all the best of luck in the upcoming months. Stay safe.